Welcome, everybody. I'm sure there will still be a few of you trickling and joining today, so that's absolutely fine. Don't worry about that. But welcome to our NHS webinar today. I am Jordan from Pathway CTM, and I will just be facilitating things in the background. So I'm just here to help with all the technical bits and bobs. You should be able to see that a poll has just launched for you. So it would be great if you could just answer those questions, just so we can hear from you really, and yeah, find out a bit more. So I'll give you all a minute to answer those. And if you have just joined, it should still pop up for you, so don't worry about that. That's fab. See, most of you have voted there. I will just give it, there's a couple more, so we'll just give you a few more seconds to make sure you get your answers in. Fantastic. Okay, I'm going to stop that there so we can have a look. So we can see that the majority of you, 91% of you, are students. We have a few parents and a few teachers as well, though, so that's great to see you there, and nice to know that you've joined us this evening. We've got mainly a mix of year groups, but slightly a majority of year 12, so that is absolutely fine and good to see. And 65% of you don't know anything about what a healthcare assistant does yet, and you're here to find out. So you're in the right place. And for those of you that do know, great, hopefully we can just continue to give you a bit more insight into that. So just before I pass over, I just want to reiterate, I know that a lot of you have already popped in the chat box saying hi, and that's great to see, but you can communicate with us through the chat box today, or if you have any questions at all, do pop them into the Q&A box, and we will have time to answer all of those at the end. So without further ado, I'm going to pass over to Claire.
Lovely, thanks Jordan. Hi everyone, it's great to have you all here, although it's virtually at the moment, so it's really good to be able to talk to you about a really exciting role, particularly in National Careers Week, about one of our key roles in the NHS. And we've got some great panellists, hopefully all here to talk to you, to help you have a greater insight in what the role does as a healthcare support worker. So as Jordan says, my name's Claire, I'm Claire Wardle, I'm a programme manager, and I work in what's called a nursing team that covers across the southeast of England for Health Education England. So Health Education England are like the education and training arm of the NHS. So we work with and support employers to ensure they recruit, train and educate the right staff with the right skills at the right time. So it could be doctors, nurses, physios, and we also help with a lot of new roles in the NHS. And apprenticeships as well. So that's something really key in the NHS at the moment. Thank you, Jordan. Next slide. So just a little bit about the South East. We obviously cover counties of Kent, Surrey and Sussex, Oxfordshire, Berkshire, Buckinghamshire, Hampshire and Isle of Wight. But for the purpose of the event this evening, we're really focusing on employment opportunities within Berkshire, Oxfordshire and Buckinghamshire. And we've obviously got Hadley here today, a recruitment advisor from Buckinghamshire. And we've got another panellist here today, it's Paul. And he's from a trust in Oxfordshire. So hopefully you will have a bit of a flavour of some of the opportunities in some of those counties. Okay, lovely, thank you. And just to talk about what our local NHS is, I mean, that includes acute hospitals, our community hospitals and community services and mental health services. And obviously not forgetting our primary care services, so your GP practices. There's lots of nurses, lots of healthcare support workers in those areas as well. But we're really going to focus on sort of our larger trusts within those counties, so Oxford University Hospitals, Royal Berkshire, Buckinghamshire Healthcare Trust, Berkshire Healthcare Trust, one of our community mental health service trusts, and Oxford Health Foundation Trust. Now, hopefully, I mean, Paul is obviously on duty this evening, and another one of our panellists we're hoping to join from Oxford Health Foundation is Paida, who's at the moment, she's a trainee nursing associate who was previously in her other role a healthcare assistant. So we're hoping she'll be able to join us slightly later. So hopefully it'll give you a flavour of some of those trusts and the opportunities available. Thank you. So what is a healthcare support worker? And already there are so many trusts and roles and titles of the healthcare support worker. Sorry, someone is trying to call me at the moment. So what is a healthcare support worker? It represents a world of opportunities within the NHS. And it's a great entry point or starting point for someone to start their career in care. There are lots of different titles. So you will hear healthcare support worker, healthcare assistant, clinical support worker, nursing assistant. And at the end of the day, they're all doing a very, very similar job or the same job. And even in different trusts, different parts of one big organisation, you might hear different terms of different roles. So do bear that in mind. And hopefully by the end of this session, we can sort of guide and advise you when you are looking for a position on, say, NHS Jobs. A key website that we'll go through is just thinking about some of that terminology to help you in your search, perhaps for a position. So, as I said, you can go back if you want to, thank you. They're a vital part of the clinical team. A healthcare support worker will be given that hands-on care to patients or at the patient's bedside or working closely with patients and supporting those therapeutic relationships. As I said, they can be found working in all sorts of settings, so whether that's a larger hospital, doctor's surgery, in the community, maternity units, or even in people's own homes. They can be given help and support to patients and their families. And there are actually no specific national requirements for becoming a healthcare support worker. You obviously need to be passionate about working with people, caring and compassionate to apply for a job. And thinking about values are a really key asset, and they're really important to the NHS. So if you have some time, do look up the NHS values. And obviously, once you've been accepted, your employer will provide the training that you need as part of an induction, and we'll go on to what you can expect. But as you can see from the illustration there, there's lots of different roles. So whether you're a support worker in theatres, so very specialist, working with children, maybe you're providing more of a therapy support, so working alongside OTs and physios as an allied health professional support. Maternity support work, obviously working within the maternity services, and mental health support worker, so working alongside. So you might not be giving so much physical care to an individual, but they might be doing lots of talking, supporting and helping people through their everyday activities. And obviously there is the adult one as well. Jordan, has the presentation disappeared?
I think Jordan's dropped off, Claire.
Oh my goodness.
Yeah.
Okay. Okay, let's carry on. I'm just trying to think what else is in my presentation. So I mentioned about the titles of the different roles. So throughout the presentation, we're going to direct you to some resources. So some key areas to look at are NHS Jobs, and I've got a nice little slide to actually show you how to find a job with the NHS. And I definitely recommend looking at trust websites as well. They often have a section on working for us, and I'm sure Hadley will direct you for the Bucks Healthcare Trust as well. And so that was my main presentation, really, just to go through. Oh yes, I was going to do some hints and tips on when you do apply and what employers really look for when you put that application in. So what I would suggest, first of all, is to do your homework about the organisation that you wanted to work for. Maybe that you're thinking about a local trust or organisation that's close to you. And you need to have a look at the job description of actually what they're asking for in the job. And you can normally expect, if you've perhaps not got any experience in care at all, you might be looking for a healthcare support worker position at band 2. And just to let everyone know, there is no presentation at the moment because Jordan has actually dropped off the call. So what we're doing, we're just carrying on chatting about what's in the presentation, and hopefully everyone can still hear me. We're just going through exactly what's required. Here we are. Oh, we've got Ellie.
Hi everyone, I think Jordan was having a slight issue with her Zoom, but you've got me here, so don't worry at all.
Oh, lovely. Thanks, Ellie. Nice to see you. Just wondered, Ellie, did you have the presentation?
Yes, I can see Jordan's popped up there as well. So Jordan, you're right to share the presentation there, and I'll just hang here. It looks like you're on mute, but don't worry at all.
Apologies for that, everybody. There was a technical malfunction, but I am back, hopefully.
These technical things are always sent to challenge us, aren't they, Jordan? So
No.
Great,
lovely.
that looks brilliant.
Okay, just going back to this, this slide, down the bottom there, you can just make out there's some really good resources in health careers. So if you've ever got any questions or thinking, well, I could be a healthcare assistant, or I'm thinking about another type of job in the NHS, do go to the Health Careers website. They do little quizzes, and you can compare and contrast different jobs you're thinking about. So that's always worth going to. And it does course finders or looking at what qualifications you need for a particular role. So that's always worth looking on to that site. So yeah, if we could have next slide, please. Lovely. So we're still on the sort of the training now. So the Get Ready, this is a bit of a talent for care sort of strategy for us in Health Education England. And it's get ready, get in, get on and go further. And it's just trying to break down the different stages of when you first come in early on in your career, and then where you can anticipate to go. So Get Ready is what you are doing here today. You're listening about the opportunities, thinking about your different choices and different careers that might be available to you. The Get In is about those opportunities for people to start their career in a support role. Get On is supporting people to be the best they can be in the job that they do, and that's part of the induction training, and I'll talk more about that in a moment. And Go Further, that's really about providing those opportunities for further career progression. For an example, you can, from a healthcare assistant, potentially move into nursing longer term through a process of perhaps undertaking an apprenticeship, for example. So there are lots of different opportunities. And once these slides are sent to you, down on the left-hand corner of this slide, there is a YouTube little clip embedded. So you can have a look at a live illustration of some typical opportunities open to you. And it's just a nice, fun, cartoony, interactive thing. So that's quite nice to watch at another time. Thank you. Next slide. Okay, if we move on, lovely. So this is just part of the get on bit and supporting people to be the best they can be in the job that they do. And this is just to give you an idea that should you then apply for a job as a healthcare support worker, you would be expected to undertake what's called the care certificate. And that is a a minimum framework, like an education programme with a number of different standards you would be expected to take. This was introduced in 2015 to ensure that all health and care staff had the same consistent training and education to ensure they provided good quality care to our patients. So it's quite a chunky piece of work. It would normally take you about 12 weeks to undertake, alongside working as well, and you'd have training to prepare you. And as part of that care certificate, there is a code of conduct for healthcare support workers, and you can easily Google both of these things and you can actually see the standards that is involved, and the expectations of the role of the healthcare support worker as well. And a lot of these numbers of the code of conduct would be included in the job description. So, for example, you would expect to respect a person's right to confidentiality, uphold and promote equality and diversity, and be inclusive in the care that you provide. So that's just some examples. And the care certificate standards are based very much around privacy and dignity, nutrition, communication, health and safety, all those essential things for our patients that we should all do. So you would expect to be, when you're inducted, to start and be enrolled on the care certificate. And then normally you have a graduation once you finish. And the care certificate is also being threaded through now with functional skills like English and maths, that should you not have that already. And also it is embedded in a number of higher level apprenticeships as well. So it'd be great to have that under your belt as well. Thank you. Next slide. So this is the sort of further on down the line, the go further, and this is where we can provide the opportunities for career progression, including entry into the registered professions. So it could be OT, physio, nursing. So certainly on completion of the care certificate, you can then consider those other opportunities that are available to you to progress your healthcare career. Further training is always offered as well. So that could be in-house training that's provided by the trust or the employer, the organisation. It could be specialist training. Perhaps, as I mentioned earlier, you might be working in theatres, so they might show you how to work a specialist piece of equipment. Clinical skills, you might be taught how to take blood, insert tubes into veins, certain catheters. Functional skills to support with levels of numeracy and literacy. And you may even be supporting other support staff and their training and education as you become knowledgeable and you gain experience. And there is, some people don't wish to go on to a professional registration. They prefer to stay within that role of a healthcare support worker, but maybe develop into a team leader role or supervisor. So that is also possible. And there's obviously the opportunity of gaining further qualifications like apprenticeships. And these can vary from entry level up to the nursing associate. So you'd undertake a foundation degree. Assistant practitioner, which is another course you would do with a foundation degree, and also registered nurse. So that's a potential. Thank you. So I mentioned these earlier, just some useful links and resources. Health careers is always my first line. Always have a look at there, all the different careers, and that is fairly up to date. I've got a YouTube clip there as well, really nicely done by Health Careers, a variety of individuals across the country talking about their role. Some are in a busy hospital, some are undertaking an apprenticeship, some are working in GP surgery as well. So I just thought it was a really nice selection to watch on YouTube there. NHS Jobs is the key job site for jobs and opportunities. So do have a look on there. There are live vacancies for our trusts that I mentioned earlier. And also, as I mentioned, looking at the trust websites as well. So typically there may be a site called Working For Us, and I'm sure Hadley can talk about his trust as well. And they do advertise directly and provide information about their services and values. So it's always worth doing your homework about the organisation that you're applying to. Indeed is another website to have a look for. jobs as well. Step into the NHS is a good resource for, again, finding out about those different careers, different pathways. And also there's a link there, it looks quite a long link, but it's about how much you would get paid on the different banding. So that's might be worth having a look at to give you an idea. And it's called Agenda for Change, the NHS pay scale. So typical entry point, as I mentioned, is a band 2. But sometimes if you've got some experience, you may be able to apply for a band 3. So thank you. Next slide. And this is just a quick snapshot of what that first page of the NHS job website looks like. It looks very busy, but it does have a simple search facility. You can use keywords if you're looking for a particular role. As I mentioned, there's lots of different titles of the healthcare support worker, so it's worth doing a search for different things. You do have an advanced search feature. You can register and sign up for any alerts should any jobs become available. And also in that central section there, you've got some little hints and tips for job seekers. So about making successful applications, it's worth having a look at that as well. So thank you. And just briefly about completing an application, you will be in competition with others, so do take the time to prepare and make some notes. I started to talk earlier about a job description. It's really worth having a really good look through the job description of the job that you're applying for, so you are really clear what it's saying, what the job entails. So you have a clear expectations and what they're asking for. And alongside that, you will have the person specification as well. And that will normally clarify on what they see is essential to the job and what skills are desirable. And have a think about how you match with those. And map your skills and experiences, really. But don't be put off that think, oh, I don't have any experience, because very often you don't need experience as a healthcare support worker. But it's really about selling yourself and what you can offer as well. And just because perhaps you haven't had the opportunity of work experience this year, it's been really poor to be able to access that. But it's thinking about, have you got a part-time job? Have you been caring for a neighbour or a member of your family? Do you do any volunteer work? So really think about what you're doing. Maybe you've done something at school and worked as part of a team, or done something at college. So have a think about that. And if you can't think about anything, chat to friends and family as well to help you do this. Always try and add some examples when you're writing your supporting statement and saying why you're applying for this job as well. Lots of examples about what you can do. Spell check is important, or get someone else to read it through. And always focus on that supporting statement of the job being advertised. And don't just put a few lines, really write about, try to, about you as an individual, what you've been doing at school or college, or about a previous job that you've had, and why you want to apply for that particular job. Because sometimes people write supporting statement and it could be applying to any job. So really say why, and at that place of work, why you want to work there as well. So that's really important. Thank you, Jordan. Next slide. And you might be expected to have an interview in this virtual world at the moment. So just some brief hints and tips really about finding a quiet space, preparing the people that you live with that you need a bit of quiet. Check your technology. We know it doesn't always work, and you have enough charge on your laptop or whatever. Practice answering the questions as why you are applying, why you would like to be a healthcare support worker. Have a think about that. And think about accessing the support and advice through Health Careers as well. And they do have a number that you can call as well. Or if you see a job advertised, it may be worth seeing who's advertising it, and if there's a particular name or email address that you can get in touch with if you have any questions. I think that might be the last slide, Jordan.
I think it is. Yes.
Thank you.
So thank you for that, Claire. That was really, really valuable information for anyone looking to apply, and especially those last few slides, they're all applicable to any job application you're going to be doing. Some really key tips there. So I think now it's time to say hello to some of our other panelists who kindly joined us today. So I would just sort of probably get you all to introduce yourself, who you are, what your role is, and sort of how you ended up where you are. So Haida, hello.
Hello, hi, my name is Paida. I work at the Wanford Hospital and I'm a nursing associate trainee. I started as a HCA at the Wanford Hospital, and I've always wanted to progress as I didn't feel satisfied just being an HCA. And then I got this beautiful opportunity of being a nursing associate trainee. I would encourage anyone who's second guessing being a nursing associate trainee, like, you need to grab this opportunity and run with it. Because the good thing about being a nursing associate trainee, you're based on a ward, you're learning on the job, and the beauty about it, you've got a supportive team. I've got dyslexia, and they'll support you. There's so much support. So if you're autistic, dyslexia, that does not limit you and should not limit you in joining this program. So you have support, you've got great teams. I'm currently on a placement right now in a completely different setting to what I'm used to. And the welcoming part it makes easier for the course. And yeah, I'll just encourage anyone. I did it as a HCA. I'm progressing, working towards being a qualified nurse in a couple of years, but I'll get there. So if I can do it, I believe that anyone else can do it. It's a free opportunity. Grab it and run with it. Thank you.
Thank you, Faida. That's such good advice there. And I will now pass over to Paul.
Hi, I'm Paul. I'm a nursing assistant in an emergency assessment unit over in Oxford. I've been doing that for nearly 4 years, and I'm also in my final stage of the nurse degree apprenticeship. So I am set to qualify and register as a nurse at the end of the year. And again, would reiterate everything that Paida said about taking the opportunities that are available.
Fantastic, thank you. And over to Hadley.
Hi everyone, I'm Hadley. I'm a recruitment advisor at the Buckinghamshire Healthcare Trust. So I've been kind of brought in over the last couple of weeks to really kind of help boost the care support worker numbers, also kind of look at different sources of people coming in, because this is such a kind of wonderful opportunity of someone that doesn't have to have that clinical experience or having worked in the setting to be able to join the NHS. And it's something I've always found myself coming back to. I started off in the NHS working in recruitment for NHS professionals a long time ago, and have moved around to various different businesses, from e-commerce to financial services and insurance, but have done a couple of stints with the NHS since then, and always find myself coming back. So it's a wonderful opportunity, and I think it's a great stepping stone for someone to kick off their career within the NHS.
Fantastic, thank you. And with that, having said hello to everybody, we will move on to the Q&A section, and I can see already we've had a few come through. But for anyone who hasn't yet done so, do pop in any questions you might have for any of our speakers today into the Q&A function, and we should hopefully be able to get through them all. Starting off, we've had a question in from Nana, who's asked, what's one thing you wish? So I wonder if everyone perhaps wants to just quickly say one thing that they wish they knew. I'll go to Claire first.
One thing I wish I'd known.
Yeah.
Oh gosh, that's a tricky question. Well, I'm a nurse by background, and it is very, very hard work but very rewarding. I didn't know how rewarding my career would be, and I've never regretted a day of it. And I've worked really closely with healthcare support workers over many years, and it's such an amazing team, I think, working in the NHS as well.
Fantastic.
So that's probably quite a few things.
That's all right. Pina, how about yourself?
Sorry, do you mind repeating the question again? You can't.
Is there anything you wish you knew before starting your job?
No, I loved the learning experience. Just learning on the job, for me, it was an eye opener. I just wish I had got the opportunity sooner. But it's been a beautiful experience. When I'm in a mental health setting, and when someone is unwell, it's such a challenging time, I won't lie. But the most satisfying time is when that patient waves goodbye at the door and they're so much better, they're in such a better place. There's no greater feeling. Yeah.
I can't imagine. Yeah, that sounds amazing. I suppose Paul and Hadley, do either of you have anything you wish you'd known before?
I guess I would say I came into the NHS a little bit later, and I'd gone on a different pathway for a career to start with. But the NHS and becoming a nurse was something I wanted to do when I was about 16, and I wish I'd known about the opportunities and how much I enjoyed working with the NHS, and probably wouldn't have gone down that first pathway and would have stuck to my guns.
Fantastic.
I think mine would be coming from not so much a non-clinical setting of the kind of back office support that I work in, but it's always been that kind of extra feeling of you are doing something positive, you are working towards kind of the bigger picture, and ultimately kind of helping out people get better. Although kind of we were in the back office, we were in kind of outside offices away from the clinical setting, we were having that positive impact, and that's definitely what drove us and motivated us to do a good job.
Yeah, definitely. We've had someone ask about looking at how they can get work experience or observations, especially at the moment with COVID. They've been finding it quite hard. Just from my side, before I hand it over, I would say that attending days like this or events like this, as well as we're sort of hosting, there's also virtual taster days and lots of things like that going on, just demonstrate proactive behaviour. I think a lot of people are aware that it's quite tricky at the moment, given all the circumstances. So that would be my advice, but I will pass on to Claire. I can see you've unmuted yourself.
Yeah, just to add, I definitely agree with you, Jordan. I think we've got a number of events planned with you from now until hopefully the summer. I am aware that some nursing homes are offering work experience at the moment. So if you're concerned at all, they are running some work experience. So it's worth ringing around or making contact with some of those perhaps local nursing or care homes to see if they are in your area. I know they are in West Oxfordshire. And yeah, absolutely, these events, we're also running a number of other virtual events, so it's worth linking in with your school or college career leads, or keeping an eye out. Once you've registered for this, you might well see other things advertised, and also Health Education England will advertise as well other virtual events going on. And I think it's just making the most of anything that you're doing. If you can volunteer or anything that you can do, working with people that you can then show those transferable skills is really key. And I think employers recognise the work experience hasn't been as freely available. And I don't know, Hadley, from an employer perspective, you obviously will make allowances, I would imagine. And we appreciate it's a difficult time, really, for work experience. But I think hopefully it's going to get back on track soon. hopefully by September, I would imagine.
Yeah, I think that there's going to be a massive amount of opportunity coming up, and I know that a lot of trusts are working very, very hard to kind of advertise their roles at the moment and get more engagement out there. What I would suggest as well is that just keep kind of generally looking out for these kind of events. It doesn't matter if these trusts aren't in your local area. Just go along, get yourself as much information as possible, and that will obviously increase your knowledge of what to expect, and as well as that, it will definitely help your application as well.
100%. I think that's part of the beauty of one of the benefits to come out of these virtual things, is that whilst they can be targeted, they can also be nationwide reaching. Anyone can come to anything. So do take advantage of all of these information you're receiving and all of these events. We have had as well, someone has asked, are there any healthcare support worker opportunities that are going to be offered this year, particularly in Berkshire? Catherine asks.
In Berkshire, yes, absolutely. So what I would suggest is looking on NHS job sites and setting up an alert. So as soon as any positions in that area come up, you should then receive an email. You can also have a look on those key trust websites, regularly looking, because they could come up at regular times. Sometimes they may be in the form of an apprenticeship or a healthcare support worker role. So I would regularly look. You can also contact those individual trusts, whether it's the HR department, sometimes it's the education department, but you could also make contact with the human resources department and find out from there.
Mariah has asked, what is your relationship with doctors as a healthcare assistant? So I suppose that's one for Haida and Paul to answer. What is your relationship with doctors? How closely do you work with them? Do you work with them at all? I'm sure you do.
So the emergency assessment unit is quite busy, and we sit alongside A&E. So there's always lots of doctors around, and you get to know them as you've been there a while. You get to recognise faces and things. But obviously, as doctors move around through their progression, obviously new faces come in. But generally, it's about working together for the best interest of the patient, and obviously liaising about what care needs there might be, which will include the nurses as well.
Thank you.
Yeah, in our work settings in mental health, most of the time HCAs, you're the ones interacting and spending a lot of time with the patients, so you can actually monitor their mental deterioration or improvement. So you find that in our setting, doctors would now approach you and the nurse in charge, and they do interact quite a lot with the HCAs, because you are the main people on the ground, on the ward with the patients, because most of the nurses, they'll spend time doing care plans in the office. So when it comes to questions and checking on patients, it's the healthcare assistants that doctors, well, in my speak for my ward, that they interact with. So yeah, the relationship is really close, really, when you do ward rounds, and you get to know them on a personal level, because it's the same doctors that are on the ward. So you get to know each other, and you can easily approach them if you've got any issues. So yeah, I'd say the relationship is pretty close. Thank you.
There's quite a lot of questions coming in around different qualifications or different. Is there any particular subject or a tool that you definitely need if you want to go into sort of being a healthcare assistant?
Do you want me to answer that? Any qualifications? No, I would say we don't ask for any experience necessarily or certain subjects in GCSEs, because in a healthcare support worker role, that could be an entry level role that is your sort of the first job or first rung of the ladder. And I think very often you will have the training provided. So we don't always expect you to have certain qualifications. And also now more and more employers are providing functional skills and English and maths, so we can help train you up in those areas as well. So it's very often about the interpersonal skills, the communication, the compassion, the kindness, being patient, working well in a team. And so those really sort of essential skills, really, rather than particular qualifications as such. But obviously, if you do want to then move on to higher level apprenticeship, you will need English and maths. You may well need a level 3 qualification, perhaps, to access the trainee nursing associate programme, but very often those can be provided in-house. If you come with a level 3 qualification, that is brilliant. Some people have this as a second career, may have a degree, a master's, even a PhD sometimes, or done a completely different career and are qualified an accountant. So you have different people, really diverse backgrounds, coming together as healthcare support workers. So it really does vary. But it's worth, I would say, having a look on NHS job site, having a look at some typical job descriptions of some healthcare support workers, just to really give you an idea of what's being asked for the roles in different areas. And as I say, there's live vacancies now in Oxfordshire and I think Buckinghamshire. So it's worth having a look.
Fantastic. That ties quite nicely into another question that's been asked again by a few different people about how often apprenticeships come up and when you sort of recruit for them. So I wonder, Hadley, if you have any information around that?
Yeah, I mean, with the care support worker roles, we have every role can potentially be an apprenticeship. They get signed up automatically to that. Into that system, and they get enrolled into the contact of the university that we have links in to start off in that process. Now, that's not to say that someone doesn't have to go through that apprenticeship program, but they have to do kind of certain bits and pieces. But for someone else that wants to really grow, they can go all the way through, and like Paul has gone all the way through up to doing the nursing degree. So there's lots of opportunity to go that route. Also, what's great with the NHS is then you can go into any other route that you like, whether that be kind of back office work or into management, that kind of thing. There's a infinite amount of opportunities.
Yeah, and with the interview processes for the healthcare assistant roles, are there many, like, what sorts of, a couple of people have asked what the steps are in that process?
Yeah, so we've got certainly kind of only speaking for Bucks at the moment, we do a interview with a clinical professional. So that might be a ward manager within the kind of particular wards that's looking at the moment, or a senior nurse that's had quite a lot of experience with working with healthcare assistants. And really what they're going to do is not necessarily look for the kind of qualifications and experience, but and I'll put the link on at the end as well, which provides a really good insight into what we as a trust and generally kind of what the NHS trusts are looking for with healthcare assistants. And it's things like being kind, being able to relate to people, being really kind of being able to understand someone and look after them on kind of a very one-to-one basis, and be being close to people, building relationships, that kind of thing is something that as a trust we're starting to ask those questions, rather than give me an example of a time you've helped someone. We're kind of trying to move away from that at the moment and really bring in people that are just kind of caring and willing to learn.
Fantastic, yeah. We've also had Vicky's asked, do you feel that you have enough support, because obviously the NHS is very busy at the moment? Is it a stressful job working as a healthcare assistant? So Again, Paida, I will pass that to you first.
To be fair, since the pandemic started, it's been really busy. It's been overwhelming at some points, and it takes a toll on you physically and mentally. But obviously, they've been some staff that had retired, they've been redeployed, they've come back into the system. So that has sort of relieved the pressure. And naturally, it's been a year now, and naturally you just adjust to the pressure and you rise to the occasion. I don't know how we manage it, but there are systems in place to support us, incentives. Yeah, I think, and at the end of the day, in whatever ward you're set up, ward setting you're working in, it's all about teamwork and working together and supporting each other when, you know, times get difficult. So it has been difficult, but I think working as a team has helped, and the support from the trust as well.
Yeah, no, I think that's amazing and very sort of honest advice there. I personally don't know how you've all managed. You are all heroes in my eyes, so it is incredible what you've all been doing. I don't know whether, Paul, you wanted to add anything, or if I can carry on. We've got a lot to get through.
All I was going to say was that obviously there's been a lot of pressure. We've been fortunate that we've worked with the staff in A&E, so we've all kind of supported each other. But it has been quite busy, and I've been fortunate that my training program has managed to stay as it was, which I know other people didn't manage that quite in the same way, but I was fortunate that I was able to stay as it was.
Amazing. We've actually had someone ask if you've got any tips on starting as an HCA, working with A&E. So I think, Paul, you'd probably be best to answer that. Any top tips for anybody?
All I would say is, because I originally started in A&E when I first joined the NHS, is from an A&E point of view, be prepared to learn. Don't think you know it all. Be prepared to learn, and be prepared to let people support you to learn these things, because it is busy.
I don't doubt it. We've had someone asking what the working hours are like and what the salary is like. I know, Claire, you mentioned that it was usually band 2 that you go in on, but I wonder if there's any more information around what sort of the typical working hours are like for an HCA.
I mean, normally for a working week, you'd be expected to work about 37.5 hours a week. Sometimes they can be in different formats, so it might be it could be classed as a shorter shift if it's sort of 7.5, 8 hours, or it could be a long day. And I think it's sometimes looking at those things that are included within that job and whether that's practical for you. You know, if it's a long day and it's an early start and a latish finish, are you physically able to get there on time? And thinking about, you know, simple things like modes of transport and things like that. So, you know, some hospitals are a nightmare for parking, but, you know, it might be good accessibility for public transport. So it's thinking, can I physically get here at the start of the shift, or do I need that flexibility? And sometimes you do have flexibility in hours, but that's something that you would need to discuss with your potential employer, or if you wanted to work part-time hours, or if you had caring responsibility. So it's something worth talking to your potential employer about hours and things like that. Normally for a band 2, you'd expect to start around 18,000 or so, and within each pay band you will have different scales depending on level of experience. So it's worth having a look at that agenda for change on what you can expect in terms of salary wise. Shift work, you might be doing earlys and lates, as I said, those shorter shifts or long days, or there might be working weekends or might be working nights. All depends on where you'll be working and the job that you'll be doing. So that's all the information you need to find out about that job, and if you think that would suit you as well.
Wow. And someone's asked, what's the most important thing to mention during a healthcare job interview? What will make them pleasantly surprised? So I suppose, Hadley, is there anything for you that you think, if you're interviewing candidates, what's something that really makes them stick in your memory or stand out to you?
I think it's going to be someone that has actually done their research about the trust, know exactly what they're going to be expecting, that they've actually read the job description and kind of understood it. And as well, I think that the best thing is to come with lots of questions, and really kind of be inquisitive about the role. And I mean, a lot of the questions on here that are coming up are going to be really nice for a recruitment department to look at answering. And it will certainly help you stand out from the rest of the applications.
Yeah, that's great advice. We've had someone, quite a few people have asked, what skills do you think are needed to work for the NHS? I don't know whether anybody wants to jump in particular, a skill that you think is definitely necessary to work for the NHS.
I would say patience, and I'd call it a skill, but empathy. So thinking about how other people are feeling, being in their shoes, and be able to demonstrate that empathy is really key, and thinking about those key people skills. I don't know whether anyone has anything to add, but
I think I saw Paida. Did you go to say something as well there?
She took the words out of my mouth. I was going to say empathy.
That's fine. Empathy, I think, yeah, you do have to be an empathetic person. Someone, we've had a few people asking what made you want to work for the NHS in particular, which, again, I suppose everybody will have their different reasoning. So if you want to sort of just go around, I'll start with Paida, because I can see you're unmuted there.
Oh, okay. NHS is a force to be reckoned with, and they've got room for growth. You've got room to grow, and that's something that I've always wanted. I used to work as a carer, and I just, in 5 years' time, I would just see myself as a carer, although inside I wanted more. I wanted to progress, and I wasn't getting it. So with NHS, they've got, as long as you're willing to learn, as long as you have that drive, the sky is the limit. You can be anything you want. There's room for growth, and that was what I was after, and that's what I'm getting. So there's satisfaction there.
Amazing.
Yeah.
I'll go to Paul next.
So I guess, as I said, I kind of went away and did something else, but it was something I wanted to do originally. I'm quite a caring person, volunteer with a care organisation as well, so it was kind of a bit of a natural fit to go with the go down the NHS route, but then didn't, and then came back to it and wish I had done years ago, because I do just, it's about the compassion and the empathy that kind of gets me. Yeah.
Claire?
Yeah, I just wanted to help people really, and care for people. I always felt quite confident that going into nursing, I would hopefully always be in employment, and I'd always have opportunities open to me, and it would give me that flexibility of being able to work abroad or work in different areas. So that's why I sort of chose nursing, and the NHS seemed a natural way in, really.
Amazing. And Hadley, finally, over to you.
I think it was being part of the team. I think there is a certain camaraderie that you get being part of the NHS team, whether, again, it doesn't really matter what function you work in. You're all kind of in it together, and you work together for the bigger picture. And that's one thing that I've always valued from coming in and out of the NHS over my career. It's something I was very happy to get back into.
Amazing. We've had a question come in asking, would caring for a sick parent count as work experience? And I think that definitely that would, as Hadley and Claire have already mentioned, that it's where work experience is a bit harder to get hold of at the moment, given all the circumstances, pulling on those other experiences that you have outside of perhaps a clinical setting is definitely a fantastic way to demonstrate your sort of caring qualities and your empathy. I don't know whether you guys wanted to add on to that at all.
I think it's just to reiterate. I mean, certainly from Bucks Trust point of view, we're not looking for kind of that experience. We're looking for, well, not necessarily obviously going to help, but we're looking for someone that, I mean, is empathetic, is going to really kind of want to care and want to grow and want to learn. Is all we're really looking for with to kind of really kick off your career with the NHS.
I think we value any experience, because some people have been ill themselves or got a chronic condition and they feel they want to give something back. So, you know, we appreciate everyone has different reasons for wanting to come in. So, yeah, we just value all different experiences, and that would help, but it's not essential.
Amazing. We've had Hyatt ask, do people get transferred from different medical departments as an HCA? So do you sort of go into one department and stay there, or do you get moved around at all?
You don't normally get moved around. Sometimes, if there perhaps there's another, perhaps a ward or department close by who might be particularly short, you might be asked to perhaps lend a hand or work with a different team, maybe for a day or two. But generally, if you've been employed on say one typical ward, you would stay there. Some people would like to go to and visit other areas, or they might apply for another job elsewhere or be able to have a transfer. Or sometimes people join sort of a bank and can work additional hours to where they normally work to try different areas. So there may be opportunities in that way if you want to try other areas to work.
Oh, sorry, I don't know what's happened here. 1 second. There we go. Yeah, no, thanks for that, Claire, though. I'm just cautious of the time. I know that we do we've got a few bits to sort of wrap up in with at the end, but I thought I'd end on one more question, which was if you could all give one piece of advice to all of those who've attended today who maybe are considering working as an HCA or within the NHS, what it would be. And I know there's been plenty of advice and tips given already, so I'm aware that you might have to think outside the box, but if anybody wants to go first, feel free.
I think my best bit of advice would be to, again, like I said, prepare your questions, do your research, and you mean don't necessarily kind of go into or don't rule anything out. Don't go into the interviews with or the applications with your minds open.
I think I'd say that there's various advantages and options available. So just take the bull by the horns, if you like, and go for it, and something will come up that will suit you once you're in the door.
And can I just add to that, Jordan? And I think that's very true about doing your research, knowing what you're applying for, because some roles as a healthcare support worker, you will be providing intimate personal care to patients and helping them with toileting, washing, dressing and feeding. So it's really knowing what you're letting yourself in for and if you're comfortable with that, and doing the research as Hadley said, and reading what you'll be expected to do and looking at that job description. So for me, that's quite important, just to point that out really about the roles, but they are such a variety of roles and opportunities. It's just, as I think Paul said, it's just getting the right one for you.
Yeah, definitely. And Paida?
I would say after going through the applications, follow your heart and make sure whatever you decide to do, your heart is in it. Because if you love what you do, you don't have to work any day of your life.
That's a fantastic piece of advice to end on today. So I will just go, I have popped in a link to a short survey into the chat box. If you could just take 1 minute to fill that in, it will help us to just continue to provide you with support after this session for any NHS applications you may be going through. So that would be really useful if you could do so. And then also do remember that you can get in touch with us via these different ways. So you will be able to have access to this recording sent to you following the event, but there's also plenty of other webinars that we've done previously with the NHS available on our YouTube. So do go and use that information and take it all in. But we will be sharing all the links that have been shared today in the PowerPoint with you, so don't worry about that. And apart from that, I just want to say thank you to Claire for hosting initially. Thank you to all of our panellists for taking the time out of your days today to come and give some advice to all of the young people. And thank you to everybody who has attended for giving us your time this evening. And it's really, really, really great to see so many of you with so many questions demonstrating proactive behaviour and looking really keen to get involved. So thank you, everybody.
Thank you, Jordan. Thank you, everyone.
Thank you.
Thanks, everyone. Take care.
Thank you.
Thank you.
Thank you. And I've